Indonesia becomes Asia's COVID-19 epicenter. Hospitals are overstretched, cemeteries are full, even vaccinated doctors are dying. So, how did the outbreak spiral out of control? This is Inside Story. Hello and welcome to the program. I'm Mohammed Jamjoom. COVID-19 is sweeping across Indonesia at alarming speed. It's overtaken India as Asia's pandemic hotspot. The country recorded more than 34,000 new infections and 1,300 deaths on Monday, although that's down from Saturday's peak of nearly 52,000 cases. This chart from the University of Oxford's Our World in Data shows the numbers going up dramatically over the past month. Researchers believe the real figures could be much higher because of low testing rates. The highly infectious Delta variant is driving the surge. Indonesia has the highest COVID-19 fatality rate in Southeast Asia. Communities are relying on volunteers to bury relatives who died at home. Makeshift graveyards are working around the clock. Hospitals are turning away patients because they don't have beds or oxygen. Some are even telling people to bring their own oxygen supplies.
I came here from Sendana Hospital. I filled 10 oxygen cylinders last night. I'm here to buy 10 more cylinders.
Only 6% of Indonesia's population is fully vaccinated against COVID-19. The country is relying on China's Sinovac jab, which appears to be less effective. 114 doctors have died this month, despite 95% of health workers being inoculated. The U.S. is donating 4.5 million Moderna vaccines, some of which will be used as booster shots. The government has banned non-essential travel over the Muslim holiday of Eid al-Adha to try and curb new infections. All right, let's bring in our guests. Joining us on Skype from Jakarta, Irma Hidayana, co-founder of Lapor COVID-19, an independent coronavirus data initiative. From Brisbane, Australia, Dr. Dicky Budiman, an epidemiologist and PhD candidate on global health security at Griffith University. And also from Jakarta, Bambang Harymurti, a public policy analyst. A warm welcome to you all, and thanks so much for joining us on Inside Story today. Irma, let me start with you. Many believe that the government's data doesn't reveal the extent of this COVID-19 crisis. What do you say to that? Are the numbers being underreported?
Yes, it is. So we're, as citizen reporting data initiatives, actually, we collect data from the grassroots level, and we saw that many, like for example, many deaths are not being counted as COVID-19 death. This is a real problem, and we also try to look at the official data at the city level, and at the provincial level, and then at the central level. And unfortunately, there is a discrepancy of the number of COVID-19 death data that are released by this different level of government, the city level, provincial level, and the central level. So this COVID-19 data transparency remain a huge challenge for Indonesia. And as we know that data is one of key important element to tackle this pandemic, because without having a real data, without having the data that is accountable, that is reflecting the situations on the ground, I don't think that the decision maker could make an evidence-based public health decision maker in order to control the pandemic.
Bambang, we're seeing these heartbreaking scenes play out in different parts of Indonesia right now, whereby you have people being turned away from hospitals, hospitals not having enough beds, hospitals not having enough oxygen, there being oxygen shortages. Just how stretched are the hospitals right now? And from your vantage point, is the medical system close to collapse?
Well, I think it is actually basically some already collapsing, yeah, because now they have to add more room to the hospital. So many hospitals now cannot accept non-COVID patients because they are increasing the capacity for COVID patient cure or treatment. Yeah, it's clearly, and not only that, you also begin to see that many more people died while they are doing their own independent isolation in their home. So many of the community health services whose job at first was only to monitor them and to bring them to the hospital if things getting worse, now end up have to bury them as well because they couldn't bring them to the hospital because hospitals are full. And many also died in the ambulance on the way there because the ambulance couldn't find a hospital that can accept them. In fact, the governor of Jakarta just stated that there are 1,900, almost 2,000 people waiting at emergency room for room inside the hospital, and outside the emergency room, there are almost 1,500 people in Jakarta that are waiting to enter the emergency room. So you can imagine that many actually don't even bother to go to hospital, or they just go around in the ambulance or in other vehicle just to try to find whether there might be any other opening in the hospital somewhere else.
Dicky, where do things stand currently when it comes to testing? Are there enough COVID-19 tests that are being done to get an accurate count of the number of cases?
Unfortunately, since the beginning of the pandemic, Indonesia remain in the low rate of this testing and tracing capacity. And it's shown by we can see the test positivity rate of this country since the beginning of pandemic up to now. It's always above 10%, and it's mean and another level also regarding their community transmission. It's since April up to now still in this level, community transmission. And it's mean the country and many regions in Indonesia cannot be identified, and also not only the infection cases, but also the cluster. Then it's put the country in vulnerable situation, because then we see what the Irma say and also the Bambang say, that the government figure is not reflected the real condition in the community. And the main reason of this is how to find it. If we cannot find the infection, then how come we can cut the transmission? Because isolation and quarantine is the main strategy that we have to do to cut this transmission. And the other things is that now we face this very serious threat, which is the Delta variant, which is not only by we cannot only dealing with this restriction, but we have to combine with very extreme, not only powerful or just strengthening the testing capacity, but for Indonesia, I advise extreme testing, more than 1 million a day at least, to find the infection among the community.
Irma, your organization has been involved in collecting data related to COVID-19 cases across multiple sectors of society. Let me ask you, what are the numbers like when it comes to people who've died from COVID-19 who are in self-isolation?
Right, that's a great question. I think it's we collect this data based on social medias and mass media reports, and also our local networks. And then we did triangulations to make sure that we don't have double data, to make sure that the data is accurate enough. And since June until now, we recorded that there are at least 712 people who died during the self-isolations at their home, as mentioned by Bambang, that so many families, so many people, so many patients have been turned away from one to another hospitals, and resulting that they have to stay at home, they have to go around finding medical help, and then this let some of them to die at home without any help. But I wanted to emphasize that the number of the healthcare workers in Indonesia who died from COVID-19 is also very big. So far, over the past 1.5 years, we recorded that more than 1,440 health workers across Indonesia who died from COVID-19. And this month alone, in July, we are not yet in the end of July. So this month only, there were 224 healthcare workers who died from COVID-19. So this is very disappointing. This is a very sad situation.
Irma,
and I would say that...
Let me just, sorry to interrupt you, but let me just ask, when it comes to that point about the record number of health workers who've died due to COVID-19, I've seen the reports that there have been doses of Moderna sent by the U.S. To Indonesia, and that the plan is to give the Moderna vaccine as a booster for the healthcare workers. Why have the healthcare workers been so vulnerable, and will more be done to protect them going forward?
I think Dr. Dicky would be the great person to answer this question. But
Sure.
Let me just jump in very shortly. I think because the transmissions of the virus, the magnitude of the pandemic, it's way too big for us. This make so many patients comes to the hospitals. So many hospitals across Java and Bali Island, they are all full. So can you imagine when the hospital are full with COVID-19 patients, you can imagine the transmissions of the virus around inside the hospital. And then the number of health workers also at the risk of infections of the virus, because they are very intense and they are continuously helping the patients in the hospital. So they are very prone and they are very in a risk of infections. And also, of course, we need to note the presence of Delta variants. As for the vaccine, I guess Dr. Dicky Budiman
Sure.
would be the right person to answer. Yeah.
All right, Dicky, let me go to you then and throw the same question your way. First of all, will more be done to protect healthcare workers in Indonesia? Why is the situation so bad for them right now?
So, actually, almost 90% of our healthcare workers already got this Sinovac vaccine 6 months ago, more than 6 months ago. Then I can see the analysis from the latest situation that seems this Sinovac vaccine decreasing the effectiveness, effectivity again or in protecting the healthcare workers. So it's mean that's very important point. And this analysis is related to the funding from the research, but still not published yet. But the second one, it seems this Sinovac vaccine less effective. Effectivity is less effective against the new variant, especially the Delta variant. So that's why I'm also one of the epidemiologists in Indonesia who advised the government since last month that our healthcare workers need more protection, and in this relation, we need this booster because Irma already mentioned that's correct, man. Because they are very vulnerable because the number of these patients is increasing, and of course, during this situation, exhausted, there will be a point of this weakness when they feel exhausted. So of course, then this transmission will be easy to get, and of course, as the one also the epidemiologist in the world who contributed the WHO definition. Now the WHO now in development the definition of aerosol and airborne. I can say the potency of this Delta variant in transmitting through this airborne mechanism or aerosol is very effective, and that's why we can see from situation in Indonesia, it's easy even from in household in one let's say one room in maternity or in hospital, or almost 100% of secondary attack rate. So we can then see what the Irma already mentioned, the number of these breakthrough infection among healthcare workers is increasing, and even the date number. So again, that's why this protection is very important, not only by the providing them with the booster vaccination, but also strengthening the infection control and especially the personal protection equipment.
Bambang, why have vaccination rates been so low in Indonesia? And also, officials have indicated that they want to vaccinate around 3/4 of the population by early next year. Based on what you've seen so far, is that even possible?
I think I have to disagree with your assumption. I think compare with the countries in the region, vaccination rate in Indonesia is quite high. I think we have done more than 41 million vaccination, 16 million of them already on a second shot. But the problem is we are not using the most effective vaccine. We are using Sinovac, which studies in the latest studies in Thailand has proven it's not effective against the Delta variant. And therefore, there is a need to quickly vaccinate the health worker and those at risk. And I think about 2 days ago, they already started giving the third shot of Moderna to senior doctors from the University of Indonesia, and then it will keep going on. Right now, I think we are on average vaccinate about 1 million people, between 800,000 to 1.1 million people. So in terms of vaccination, Indonesia is, I think, among the fastest, yeah. But we have a very big population. But unfortunately, we don't get the the most effective vaccine, and the government is trying to remedy that by, getting Pfizer, Moderna, and also AstraZeneca, and now currently planning to have the third booster for those at risk. But we have to wait how they will do it. But I'm on that sense, I think the current Minister of Health is quite good, but he just have to clean up the mess left by the previous Minister of Health.
Irma, how much of a problem is the spread of misinformation in Indonesia when it comes to combating the virus? I mean, has that been a major obstacle?
That's part of a major obstacle. So I would say we have two different misinformation or misinformation and disinformation. So we received so many misinformations in the beginning of the pandemic, but also there is no specific and there is no strong effort from the government to address this misinformation, this hoax. It's been around since the first time of the pandemic here. And then secondly, unfortunately, when there is no action to address this misinformation, so actually, I could say the situation is getting worse, actually. Some of the government representative actually also mentions a non-scientific jokes that it doesn't necessarily they do that, which makes public even in the confusion. Like, for example, we are a very strong community because we are very religious, that COVID-19 will not get into us because of it. And then we have so many local traditional food that would make us stronger, even can beat against the virus and so on and so forth, which all of them were not based on there is lack scientific base of these situations. Instead, actually, the government should implement the risk communications method or a way in delivering or in giving a statement to public. That way, the public would more alert into the real situations. And this also include the problem of data transparency. So when the data is transparent and accountable, and when the government publish and communicate and then promote these situations, the real situation, that would make public more educated on pandemic, and also it would raise the public awareness and also alertness about the situation. So this alertness would lead the public to follow the health protocols that the government ask the public to adhere on it. But also, I wanted to make a comment on the vaccinations, because based on the survey that we had a couple times of the survey on vaccine hesitancy, but it's only limited in the capital city of Indonesia. And the findings, we found that people are still, those who are still hesitant, even though only 1/3 of the Jakarta populations, very small numbers, but it still matter, because we need to make sure that all of the population is vaccinated. But this 1/3 of the populations, they are still hesitant to get the vaccines because of the halal issues, and then the efficacy matters, and then the side effects, and so on and so forth. So this is a big homework by the government, that they have to address the situations in this way. They have to make sure the advantage of vaccinations, that the benefit of vaccination outweighing the risk. So I would say we need promotion. So we need serious communication about vaccination. And also the government always mentions about herd immunity. Herd immunity, it's been going around since the first time we have the vaccines. And as Pak Bambang mentions, that Indonesia is one of the fastest country who roll out the vaccination. I wouldn't agree. In terms of numbers, yes, it is. But the way, how does this number effective enough targeting the most vulnerable people, the most vulnerable groups, that is very determinant in order to make sure that the whole population, or most population, will get the immunity. Because when we wanted to vaccine, when we wanted to build the immunity, the population herd immunity,
Irma,
you need to make sure.
Irma, I'm sorry to interrupt you, but we are starting to run out of time, and I just wanted to ask Dicky another question here. Dicky, there had been concern before that gatherings over the Eid al-Fitr holiday might accelerate the number of infections in Indonesia, and authorities had tried to ban people from returning to their hometowns. My first question to you is, was enough done at that time? Now there is concern that people may try to travel or gather during the Eid al-Adha holidays, and I wanted to ask you, how concerning is that at a time when cases are surging as much as they are?
It will very give serious implication to our pandemic situation, because now we are approaching our peak of our curve, and in the same time we now facing this Delta variant, which we know is very effective in transmit among the people, even in very between people who already fully vaccinated. So it means both of them can be also infected. So then during this Eid, if we don't do enough restriction or give this the literacy to the community that the mobility, their mobilization and interaction should be minimized or limited, and we will face another surge case of this, not only another, but this, it will accelerate the number of people who will need more treatment in hospital, and also people dying. Because now Indonesia, it's already very vulnerable, because the most vulnerable one is already exposed to this virus, because for almost 16 months Indonesia in silent pandemic, because the low of this testing and tracing capacity. So then without knowing, so we are now in very vulnerable situation. So if people now move and without enough control, then this most vulnerable one will be easy to get infected, especially in now. We will see, we already seen actually now in rural area, the number of cases is increasing. So when they mudik or they go back to their hometown, so the problem will be spread more faster than what we imagined before. So again, I do hope that the government will limit this mobilization, especially not only because of this Idul Adha, but of course because the other in the other side that our health facility is already overwhelmed. So this is a very serious situation regarding the Idul Adha.
All right, well, we have run out of time, so we're going to have to leave the conversation there. Thank you so much to all of our guests, Irma Hidayana, Dicky Budiman, and Bambang Harymurti. And thank you, too, for watching. You can see this and all of our previous programs again anytime by visiting our website, aljazeera.com. And for further discussion, go to our Facebook page. That's facebook.com/AJ Inside Story. You can also join the conversation on Twitter. Our handle is @AJ Inside Story. From me, Mohammed, Jamjoom, and the whole team here, bye for now.